Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
And so I will call all of us to start thinking about how, as a field, as patients, to push for the idea that we need to do larger scale studies, real world analyses to better understand what the true trajectory of metastatic disease is in the setting of therapy and across time. Only then will we be able to learn whether local therapy will be of benefit or not. So, as I said, this is a really rudimentary set of curves that I drew out that suggested that at diagnosis, or when we put these patients on study, they may have 3 METs. But I have no way of predicting whether 6 months from now they have 20 METs, 6 months from now they have 1 MET. And that information is vitally critical for us to better understand how to use local therapy in the most optimal fashion. And it's about is the disease that we're seeing the tip of the iceberg, or is it all the disease that we're going to see for years? And so, I'm not going to belabor the point, but there are a number of lessons that we can learn. And I'm just going to end with this slide. But the real key point is that until we understand with real world data and with kind of big data analyses, the disease trajectories of patients over time on certain therapies, then we really will not be able to personalize our approaches of using local therapy to manage patients with metastatic disease. But I would say for the time being, I think we're doing an incredibly good job of, at least with the limited data we have, identifying patients with oligoprogressive or oligometastatic disease. And we're actually seeing clinical trial signals of benefit in this patient population. So I think more information is needed, but the trials so far have been very encouraging. And I think this is a way for us to look in the future to add local therapy to systemic therapy, especially targetable agents, in order to optimize durability of treatment response. And with that, I'll end, and I thank you very much.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelixis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.